Washington State CNA Written Exam Questions 2. Flashcard 1. What should a CNA do if he or she sees a small fire in an unoccupied patient room? A. Extinguish the fire. B. Rescue residents in the rooms next door. C. Activate the fire alarm. D. Close all fire doors. Think of the answer before the reveal. The answer is C. Flashcard 2. Before entering a patient's room, a CNA should A. Knock on the resident's door before entering. B. Check the resident's care plan. C. Make sure that the supplies are stocked for the unit. D. All of the above. Think of the answer before the reveal. The answer is A. Flashcard 3. What needs are found on the lowest level of Maslow's hierarchy of needs? A. Love and belonging. B. Self-esteem. C. Safety and security. D. Physical. Think of the answer before the reveal. The answer is D. Flashcard 4. A patient's family asks the CNA caring for a loved one about the results of a recent blood test. What should the CNA say? A. I think everything is normal, which is great. B. Let me find the nurse to talk to you about the results. C. Oh, he had a blood test. That is news to me. D. I cannot comment on patient treatment. Sorry. Think of the answer before the reveal. The answer is B. Flashcard 5. A patient is refusing to drink fluids even though he is beginning to show signs of dehydration, concentrated urine, headache, sunken eyes, low energy. What should the CNA do? A. Tell the patient to go home because he knows what is best for his care. B. Explain the risks of dehydration, respect his decision, and inform the nurse about his condition. C. Request and Roman 4 for the patient so that the patient can get fluids without drinking anything. D. Force him to drink water immediately because dehydration is dangerous. Think of the answer before the reveal. The answer is B. Flashcard 6. If a patient refuses treatment and the CNA performs this care on the patient anyway, what could happen to the CNA? A. Nothing. CNAs should always perform care on patients regardless of patient wishes. B. The CNA could be given an award for performing care under challenging conditions. C. The CNA could be promoted as leader on the floor because he can get things done. D. The CNA could be charged with assault or battery. Think of the answer before the reveal. The answer is D. Flashcard 7. Which is not a reason why a CNA should refuse an assignment? A. The CNA is upset because of a personal conflict with the patient's family. B. The CNA believes the task is unethical. C. The task is outside of the CNA's standard of care. D. Performing the task could be harmful to the CNA. Think of the answer before the reveal. The answer is A. Flashcard 8. Which should the CNA not do as a healthcare professional? A. Arrive to work on time or even 5-10 minutes early. B. Work single-handedly to take care of patients. C. Eat well and get plenty of exercise and sleep. D. Arrive at work well-groomed in a clean uniform. Think of the answer before the reveal. The answer is B. Flashcard 9. While standing in the elevator, a CNA overhears his colleagues speaking about a resident's care. What is this a violation of? A. The patient's right to medical care. B. A DNR order. C. Patient confidentiality. D. It is not a violation of anything as professionals are discussing resident care. Think of the answer before the reveal. The answer is C. Flashcard 10. How is residential nursing care paid for? A. Medicare. B. Medicaid. C. Private health insurance. D. All of the above. Think of the answer before the reveal. The answer is D. Flashcard 11. While helping a resident sip hot tea, the CNA slips and accidentally spills hot tea on the resident, causing a burn. This is an example of A. Battery. B. Abuse. C. Negligence. D. Assault. Think of the answer before the reveal. The answer is C. Flashcard 12. A CNA falsely reports that one of his colleagues accepted an expensive gift from the family of a resident. This is an example of A. Defamation. B. Insubordination. C. Negligence. D. Malpractice. Think of the answer before the reveal. The answer is A. Flashcard 13. Which of the following is not a normal part of changes in all older adults? A. Bones become more brittle and can break more easily. B. The person is confused all the time. C. Night vision decreases. D. The skin becomes more fragile. Think of the answer before the reveal. The answer is B. Flashcard 14. When speaking with a resident, the CNA should not A. Listen to what the resident is saying. B. Address the resident by Mr., Mrs. or MS and his or her last name. C. Speak loudly and clearly so that the resident can hear the CNA. D. Share intimate or personal details of his or her life. Think of the answer before the reveal. The answer is D. Flashcard 15. A CNA should not A. Delegate a task to another CNA. B. Help other CNAs with their residency. Understand delegation guidelines completely before performing a task. D. Communicate with other members of the healthcare team. Think of the answer before the reveal. The answer is A. Flashcard 16. Which of the following is the first step in preventing the spread of germs? A. Keeping living areas clean. B. Emptying trash cans every day. C. Covering the resident's mouth when she sneezes. D. Hand washing. Think of the answer before the reveal. The answer is D. Flashcard 17. In which of the following facilities do CNAs work? A. Hospitals. B. Long-term residential nursing care. C. Rehabilitative care. D. All of the above. Think of the answer before the reveal. The answer is D. Flashcard 18. The term medical asepsis means A. Practices designed to reduce the number of pathogenic microorganisms and limit their growth and transmission in the patient's environment. B. The injection of a killed microbe in order to stimulate the immune system, thereby preventing disease. C. An environment completely free from microorganisms. D. The process of killing microorganisms using chemicals or heat. Think of the answer before the reveal. The answer is A. Flashcard 19. When is a cold pack used? A. To stop pain. B. To stop bleeding. C. To decrease swelling. D. To increase circulation. Think of the answer before the reveal. The answer is C. Flashcard 20. Which of the following practices ensures adequate protection when wearing gloves? A. Hand washing before and after glove use. B. Only use gloves when touching a resident's blood. C. A small tear in the glove will still keep out germs. D. Wash hands only after removing gloves. Think of the answer before the reveal. The answer is A. Flashcard 21. Which of the following is true about older residents? A. Older residents sleep less deeply. B. Older residents have slower reaction times. C. Older residents have reduced sensitivity to touch and to pain. D. All of the above. Think of the answer before the reveal. The answer is D. Flashcard 22. When assisting a resident with a bed bath, what should the CNA do? A. Scrub the resident's skin vigorously to make sure she is clean. B. Close the curtain to provide privacy. C. Make sure that the water temperature is between 85-95 degrees Fahrenheit. D. Start bathing the resident's feet first. Think of the answer before the reveal. The answer is B. Flashcard 23. While a nursing assistant is caring for a resident, the CNA notices a foul smell coming from the resident's wound. What should the CNA do? A. Clean the wound immediately. B. Give the resident an antibiotic because the wound may be getting infected. C. Inform the nurse. D. Nothing. Wound care is not part of the role of the CNA. Think of the answer before the reveal. The answer is C. Flashcard 24. Which of the following is not part of the admissions process? A. Making the resident feel comfortable and welcome in the facility. B. Preparing the resident's room. C. Signing admitting papers and consent for treatment. D. The resident goes home. Think of the answer before the reveal. The answer is D. Flashcard 25. If a patient's chart notes that he be placed in a lateral position, he should lie A. On the back with the bed at a 45-degree angle. B. On the side with a pillow under the head, a second pillow under the top arm, and a pillow under the top leg. C. On the stomach with the head to one side and pillows under the belly and feet. D. Flat on the back with a pillow under the lower back. Think of the answer before the reveal. The answer is B. Flashcard 26. What does the diastolic blood pressure number or bottom number refer to? A. Diastolic blood pressure is the patient's blood pressure when it is too high. B. Diastolic blood pressure is the pressure in the arteries when the heart contracts. C. Diastolic blood pressure is the pressure in the arteries when the heart rests. D. Diastolic blood pressure is the patient's blood pressure when it is too low. Think of the answer before the reveal. The answer is C. Flashcard 27. Who is the most important member of the care plan meeting? A. The patient. B. The CNA. C. The nurse. D. The doctor. Think of the answer before the reveal. The answer is A. Flashcard 28. Where can a CNA take a resident's temperature? A. Oral. B. Rectal. C. Axilla. D. All of the above. Think of the answer before the reveal. The answer is D. Flashcard 29. A CNA is making an unoccupied bed and accidentally drops a clean sheet on the floor. What should the CNA do? A. Place the linen in the hamper because it is now soiled. B. Refold the linen and put it back in the clean linens pile. C. Brush any dirt off of the linen and make the bed. D. Pick the linen up and make the bed. Think of the answer before the reveal. The answer is A. Flashcard 30. When a resident has a seizure, she A. has convulsions. B. has consumption. C. has a heart attack. D. has high blood sugar. Think of the answer before the reveal. The answer is A. Flashcard 31. When performing oral care on an unconscious resident, a CNA must use A. mouthwash. B. a soft toothette. C. a toothbrush. D. all of the above. Think of the answer before the reveal. The answer is B. Flashcard 32. If a resident can sit up, pivot, and get out of bed with little assistance, but has difficulty reaching the bathroom, which device is the most appropriate to use for elimination? A. portable commode. B. regular toilet. C. bedpan. D. all of the above. Think of the answer before the reveal. The answer is A. Flashcard 33. Which is the proper safety technique for a CNA to use when cleaning a resident's dentures? A. Place dentures on a shelf next to the sink to dry. B. Place a paper towel in the sink while cleaning the dentures. C. After cleaning, place the dentures in a glass next to the sink. D. Place a cloth towel in the sink while cleaning the dentures. Think of the answer before the reveal. The answer is D. Flashcard 34. A resident receives oxygen therapy through a face mask. When should the face mask be removed? A. For eating. B. For sleeping. C. Every 2 hours. D. Every 8 hours. Think of the answer before the reveal. The answer is A. Flashcard 35. Which of the following is an objective sign or symptom and can be directly observed by a CNA? A. Nausea. B. Chills. C. Blood pressure measurement. D. Pain level. Think of the answer before the reveal. The answer is C. Flashcard 36. A pulse oximeter can be effective when attached to a person's A. toe. B. finger. C. earlobe. D. all of the above. Think of the answer before the reveal. The answer is D. Flashcard 37. When putting anti-embolism stockings on a patient, the CNA should A. Pull the stockings up quickly from the resident's foot. B. Ensure that the stockings have no wrinkles in them. C. Ensure that the stockings are very tight. D. All of the above. Think of the answer before the reveal. The answer is B. Flashcard 38. Which intervention will not help a patient with edema? A. Raising the patient's extremity above the heart. B. Massaging the extremity with lotion to stimulate blood flow. C. Using an ice pack or cold pack to reduce swelling. D. Encouraging the patient to complete range of motion ROM exercises. Think of the answer before the reveal. The answer is C. Flashcard 39. If a patient is actively dying, how often should a CNA record his or her vital signs? A. Never. B. Once every 15 minutes. C. Once every 30 minutes. D. Once every 60 minutes. Think of the answer before the reveal. The answer is A. Flashcard 40. When a resident complains of chest pains, what should a CNA do? A. Call for help immediately. B. Help the resident perform breathing exercises to increase her oxygen levels. C. Massage the area where the resident is in pain. D. Offer a pain reliever to help make the resident more comfortable. Think of the answer before the reveal. The answer is A. Flashcard 41. Which device is used to transfer a resident from a bed to a stretcher? A. Trapeze. B. Slide board. C. Hoyer lift. D. Gait belt. Think of the answer before the reveal. The answer is B. Flashcard 42. Which of the following positions will assist a patient who has difficulty with deep breathing? A. Lateral position. B. Prone position. C. Supine position. D. Fowler's position. Think of the answer before the reveal. The answer is D. Flashcard 43. What is the expected order of the 5 stages of grief? A. bargaining, denial, anger, depression, acceptance. B. Denial, anger, bargaining, depression, acceptance. C. Depression, anger, bargaining, denial, acceptance. D. Anger, denial, bargaining, depression, acceptance. Think of the answer before the reveal. The answer is B. Flashcard 44. Which of the following is the goal of hospice care? A. To restore a person's range of motion. B. To provide assistance with activities for daily living. C. To meet the emotional, spiritual, and physical needs of a dying person. D. To cure a person's illness. Think of the answer before the reveal. The answer is C. Flashcard 45. How should a CNA conduct oneself regarding a resident's religious beliefs? A. Leave it to the family to support the resident's religious beliefs. B. Provide support and allow the resident to practice his religious beliefs. C. Ignore the resident's religious beliefs. D. Try to convert the resident to the CNA's religious beliefs. Think of the answer before the reveal. The answer is B. Flashcard 46. A new resident is having difficulty getting dressed. The CNA helps the resident. Which document should the CNA use to record this information? A. Progress notes. B. Minimum data set. C. Admission sheet. D. Flow sheet. Think of the answer before the reveal. The answer is D. Flashcard 47. If a CNA makes a mistake recording a patient's temperature, what should he do to correct this notation? A. Draw a single line through the notation, write the word error beside this line and initial it. Then write the correct number next to the notation. B. Erase the incorrect notation and write the new notation in pencil. C. Cross out the mistake and write the correct number next to the mistake. D. Use liquid paper to cover the mistake and then write the correct notation over the mistake. Think of the answer before the reveal. The answer is A. Flashcard 48. Which of the following actions protects a resident's right to privacy? A. While assisting a resident in the shower, a CNA leaves the door cracked open. B. A CNA helps a resident dress behind a curtain. C. A CNA forgets to close the curtain when assisting a resident using a bedpan. D. A CNA remains in the room while a resident has visitors. Think of the answer before the reveal. The answer is B. Flashcard 49. After signing the consent forms for an upcoming invasive procedure, a patient has a few questions. What should the CNA say to the patient? A. I am so sorry, but you already signed the consent forms, so the time for questions has passed. B. I am sure you can ask the doctor right before the procedure begins. C. I'll speak to the nurse to ask the doctor to speak with you. D. What are your questions? I'll see if I can answer them. Think of the answer before the reveal. The answer is C. Flashcard 50. A CNA is assigned a comatose patient on a ventilator. The CNA has never provided care for a patient in this state. What should the CNA do? A. do the best that he or she can, as everyone will have a first time caring for this kind of patient. B. Request to switch patients with another CNA who has done this kind of care before. C. Tell the nurse manager that he/she has never done this kind of care and request additional instructions and training materials. D. Ask for pointers and tips from a CNA experienced with this kind of care. Think of the answer before the reveal. The answer is C. Flashcard 51. A patient says that he is depressed. What should the CNA say? A. Can you tell me more about this? Would you like to speak with someone about this? B. I am so sorry that you are feeling this way. C. I know there is a lot to feel sad about these days, but you'll get through it. D. That is tough. Maybe your family can help. Think of the answer before the reveal. The answer is A. Flashcard 52. If a CNA forgets to lock the wheels on a bed and a patient falls and gets injured as a result of this, what could the CNA be charged with? A. Malpractice. B. Battery. C. Negligence. D. Assault. Think of the answer before the reveal. The answer is C. Flashcard 53. Which is a safety measure that a CNA should employ when helping a resident shower? A. Make sure the resident has access to the call light. B. Check the temperature of the water. C. Lock the wheels of the shower chair. D. All of the above. Think of the answer before the reveal. The answer is D. Flashcard 54. How should a CNA speak to a patient who is in an agitated state? A. In a calm and clear manner, while attempting to determine why the patient is agitated. B. Through the patient's roommate who may be able to calm or comfort the patient. C. The CNA should report this behavior to the RN on duty, who will then manage the patient. D. The CNA should not communicate with a patient, as he or she does not want to communicate. Think of the answer before the reveal. The answer is A. Flashcard 55. What is one way to emotionally connect with your residents without crossing boundaries? A. Doing favors for residents such as calling banks to get financial information and making online purchases. B. Taking time to listen to the resident. C. Meeting with residents' families in the community to develop closer relationships. D. Receiving gifts from residents' families. Think of the answer before the reveal. The answer is B. Flashcard 56. When a resident is placed in restraints, which of the following statements is true? A. The resident is being punished for poor behavior. B. A nurse decided to put the resident in restraints. C. The healthcare team should leave the resident alone because the resident is usually violent. D. The healthcare team must check the resident's circulation at the site of restraint at least once every 30 minutes. Think of the answer before the reveal. The answer is D. Flashcard 57. A resident refuses to wash his hair even though it is beginning to become tangled and visibly dirty. What should the CNA do? A. Nothing, it is his hair. B. Tell the resident that he must bathe in order to stay in long-term care. C. Respect the resident's wishes and inform the charge nurse of his decision. D. Wash the resident's hair any way he needs it. Think of the answer before the reveal. The answer is C. Flashcard 58. Which of the following should a CNA do when shaving a resident? A. Use shaving cream to soften the hair and prevent nicks and cuts. B. Shave the resident's hair in the opposite direction of the hair's growth. C. Wash the resident's face completely and make sure it is dry before shaving. D. All of the above. Think of the answer before the reveal. The answer is A. Flashcard 59. Which is the proper protocol for droplet precautions? A. Healthcare providers must wear special masks called high-efficiency particulate arrestants HEPA masks, and the patient is placed in a negative pressure room. B. A patient is placed in a private room, and healthcare providers must wear masks and wash their hands when entering the room. C. A patient has an infection that can be transmitted through touch. Healthcare providers must wear a gown, gloves, and use special soap to treat the patient. D. None of the above is the proper protocol for droplet precautions. Think of the answer before the reveal. The answer is B. Flashcard 60. Which of the following is a sign of depression in a patient? A. An elevated temperature. B. Memory loss. C. Sadness and despair. D. Unexplained bruising. Think of the answer before the reveal. The answer is C. Flashcard 61. Which of the following scenarios increases a patient's likelihood of catching an infection? A. A patient has a cut on their hand. B. A patient has a weakened immune system because of long-term HIV. C. A patient is living in long-term residential nursing care. D. All of the above. Think of the answer before the reveal. The answer is D. Flashcard 62. All patients have the right to A. Be treated with dignity and respect. B. Discuss the results of their roommate's recent medical tests with their family. C. Play music as loudly as they would like. D. All of the above. Think of the answer before the reveal. The answer is A. Flashcard 63. Which of the following is the definition of the term sterile? A. Eliminating the spread of microorganisms through facility practices. B. A bacterium, virus, or microorganism that can cause disease. C. Cleaning an item to remove bacteria. D. Free from bacteria or other living microorganisms. Think of the answer before the reveal. The answer is D. Flashcard 64. Which of the following best describes standard precautions? A. Needles and other sharps must be discarded properly in red biohazard containers in order to help prevent the spread of diseases such as HIV and hepatitis. B. Healthcare providers wash hands and skin if they become soiled with blood or bodily fluids and at certain times during the day. C. The use of personal protective equipment (PPE) by healthcare providers when there is a risk of coming into contact with patient's bodily fluid. D. All of the above are standard precautions. Think of the answer before the reveal. The answer is D. Flashcard 65. Which of the following is not a sign of hypoxia? A. A rapid pulse rate B. An elevated temperature C. Cyanosis T. Dyspnea. Think of the answer before the reveal. The answer is B. Flashcard 66. Which of the following is not a risk factor for suicide? A. A history of alcohol or drug abuse B. A prior suicide attempt C. A stressful life event, the death of a loved one, for example D. A quiet personality. Think of the answer before the reveal. The answer is D. Flashcard 67. A nurse is very busy working with a disruptive resident and asks you to give Mr. Smith, who is not your patient, 2 ibuprofen because he has a headache. What should you do? A. Politely remind the nurse that you cannot give Mr. Smith ibuprofen and ask if there is anything else you can help with. B. Ignore the nurse. Mr. Smith is not your responsibility. C. Ask the CNA who is caring for Mr. Smith to give him the ibuprofen because it is important to keep members of the healthcare team informed about patient care. D. Give Mr. Smith the ibuprofen because it is important to work together as a healthcare team to care for residents. Think of the answer before the reveal. The answer is A. Flashcard 68. Which of the following can a CNA do to help reduce the spread of infection? A. Keep patients' rooms clean. B. Keep soiled sheets away from one's uniform. C. Hand washing. D. All of the above. Think of the answer before the reveal. The answer is D. Flashcard 69. A person lying on his abdomen with his head turned to one side is in the blank position. A. Sims. B. Fowler. C. Prone. D. Supine. Think of the answer before the reveal. The answer is C. Flashcard 70. Which of the following is not true about the Ombudsman program? A. The Ombudsman investigates concerns and resolves complaints. B. The Ombudsman certifies CNAs. C. The Ombudsman represents a resident's interests before the local, state, and federal governments. D. The Ombudsman is not a nursing center employee. Think of the answer before the reveal. The answer is B. Flashcard 71. Which of these procedures must you pay special attention to when helping a patient who has diabetes? A. Getting dressed. B. Washing hair. C. Clipping toenails. D. Brushing teeth. Think of the answer before the reveal. The answer is C. Flashcard 72. Which of the following does not apply when a CNA gives a resident a bed bath? A. Wash from clean to dirty. B. Ensure that the water temperature is at least 120 degrees Fahrenheit. C. Decontaminate your hands and put on gloves. D. Provide for privacy. Think of the answer before the reveal. The answer is B. Flashcard 73. If a CNA notices that a patient is having difficulty swallowing, the CNA should A. Mash up each bite of food to make it easier for the patient to swallow. B. Give the patient smaller bites of food and something to drink after each bite. C. Notify the nurse immediately. D. Give the patient smaller bites of food and more time to chew. Think of the answer before the reveal. The answer is C. Flashcard 74. Symptoms of a stage blank pressure ulcer include partial thickness, skin loss, and possibly a blister or a reddish/pink shallow ulcer. A. 2B. 4C. 1D. 3. Think of the answer before the reveal. The answer is A. Flashcard 75. How often should a CNA turn a patient to help prevent pressure ulcers? A. Once every 6 hours. B. Once every 4 hours. C. Once every 3 hours. D. Once every 2 hours. Think of the answer before the reveal. The answer is D. Flashcard 76. Which describes a stage 4 decubitus ulcer? A. Open wound with redness. B. Open area with visible bones. C. Black area. D. Blanching of the skin. Think of the answer before the reveal. The answer is B. Flashcard 77. If a resident begins to fall while walking with a CNA, what should the CNA do? A. Get behind the resident and slowly guide them to the ground. B. Grab a chair for the resident to fall into. C. Grab the resident by the arm and yank them to their feet. D. Once the resident has fallen, seek immediate help since the resident may be injured. Think of the answer before the reveal. The answer is A. Flashcard 78. What is the most common injury that occurs when a resident falls? A. Strained ligament. B. Sprained ankle. C. Fractured hip. D. Broken wrist. Think of the answer before the reveal. The answer is C. Flashcard 79. Which of the following is an acute illness? A. Diabetes. B. Ear infection. C. Obesity. D. Arthritis. Think of the answer before the reveal. The answer is B. Flashcard 80. Which is not a treatment for gastroesophageal reflux disease? GERD. A. Losing weight. B. Eating spicy foods. C. Avoiding smoking and alcohol. D. Not lying down for 3 hours after meals. Think of the answer before the reveal. The answer is B. Flashcard 81. Before measuring the patient's height and weight, what should a CNA do? A. Wash his hands. B. Ask the patient to remove their shoes. C. Help the patient stand up and walk to the scale. D. Give the patient a gown to change into before the physical exam. Think of the answer before the reveal. The answer is A. Flashcard 82. What is the recommended position for taking a resident's blood pressure? A. The resident is standing up. B. The resident is sitting with his feet elevated. C. The resident is lying down with his feet elevated. D. The resident is sitting with his feet on the floor. Think of the answer before the reveal. The answer is D. Flashcard 83. When caring for a patient who has started vomiting, a CNA should A. Place a basin next to the patient's chest. B. Tilt the patient's head up. C. Dispose of all of the vomitus immediately. D. Measure, report, and record the amount of vomitus. Think of the answer before the reveal. The answer is C. Flashcard 84. Which is the best method of skin care to prevent pressure ulcers? A. Apply heat to red areas of the skin. B. Keep the skin clean and dry. C. Apply pressure to the affected area. D. Massage red areas of the skin. Think of the answer before the reveal. The answer is B. Flashcard 85. Passive range of motion exercises are helpful for patients who cannot voluntarily move their limbs because A. They prevent contractures. B. They increase the strength of muscles. C. They increase muscle flexibility. D. All of the above. Think of the answer before the reveal. The answer is D. Flashcard 86. What should the CNA do to create a physically and/or emotionally safe environment for a resident who is visually impaired? A. Make sure that the resident's glasses and other visual aids are within reach. B. Remove possible environmental hazards like clutter on the floor. C. Ensure that the environment is well lit. D. All of the above. Think of the answer before the reveal. The answer is D. Flashcard 87. Which of the following is not one of the 5 stages of grief? A. Bargaining. B. Self-actualization. C. Acceptance. D. Denial. Think of the answer before the reveal. The answer is B. Flashcard 88. If a resident asks for a moment to pray before a CNA assists with their feeding, what should the CNA do? A. Allow the resident a moment of privacy to pray. B. Lead the resident in a prayer. C. Tell the resident to pray while they are being fed. D. Remind a resident that there are a lot of patients to see and that they can pray later. Think of the answer before the reveal. The answer is A. Flashcard 89. How frequently should a CNA record the fluid intake and output in a resident's chart? A. At the end of every 24-hour period. B. At the end of every meal. C. At the end of each shift. D. Every 3 hours. Think of the answer before the reveal. The answer is C. Flashcard 90. Which is an example of objective data? A. The patient has a respiration rate of 15 breaths per minute. B. The patient reports feeling ill. C. The patient reports having a pain scale of 7. D. All of the above are objective data. Think of the answer before the reveal. The answer is A. Flashcard 91. When a resident has visitors, what should the CNA do? A. Remain outside of the resident's room to keep an eye on things. B. Act as a host for the visitors, serving them food and beverages. C. Stay in the room in case the resident needs anything. D. Provide privacy so that the resident can spend time with visitors. Think of the answer before the reveal. The answer is D. Flashcard 92. A nursing assistant catches a resident with type 2 diabetes eating a candy bar and drinking a sugary soda. What should the nursing assistant do? A. Speak to the resident about her choices, encourage her not to eat and drink these items, and tell the nurse. B. Nothing. It is the resident's life, and she can do whatever she wishes. C. Yell at the resident and tell her that she is stupid for eating and drinking these high-sugar items. D. Immediately take the candy bar and soda from the resident, as these items are dangerous for a diabetic. Think of the answer before the reveal. The answer is A. Flashcard 93. Which statement is false about using a mechanical lift to transfer a resident? A. The lift must be in good working condition. B. There must be at least one staff member to operate the lift. C. The operator must be trained to use each type of mechanical lift. D. The type of sling used depends on the person's size, condition, and other needs. Think of the answer before the reveal. The answer is B. Flashcard 94. If a CNA sees that a resident is not eating enough, what should the CNA do? A. Recommend to the nurse that the resident get nutrition through enrollment 4. B. Give the resident vitamins to help supplement their diet. C. Offer the resident prescribed dietary supplements according to the care plan. D. Get the resident a new tray with tastier food. Think of the answer before the reveal. The answer is C. Flashcard 95. A nursing assistant is recording a resident's ability to bathe independently. Which document will the nursing assistant use to record this information? A. The flow sheet. B. The care plan. C. The Cardex. D. Progress notes. Think of the answer before the reveal. The answer is A. Flashcard 96. When cleaning a patient's perineal area, the CNA should be sure to wipe the resident, A. with significant force to make sure the area is clean. B. In a circular motion from back to front. C. From front to back. D. From back to front. Think of the answer before the reveal. The answer is C. Flashcard 97. Before bringing a tray into a patient's room, a CNA should A. Make sure that the resident is able to swallow the food on the tray. B. Record all of the items on the tray in the input/output log. C. Make sure that the resident is awake and alert for meal time. D. Make sure that the resident is being given the correct food tray labeled with his name and room number. Think of the answer before the reveal. The answer is D. Flashcard 98. Gloves should always be worn as personal protective equipment PPE when A. Transferring a person from the bed to a wheelchair. B. Feeding a resident who is unable to feed himself. C. Helping a patient walk down the hall. D. Assisting a resident with the use of a urinal. Think of the answer before the reveal. The answer is D. Flashcard 99. Which of the following actions should a nursing assistant always perform when helping a resident to use a bedpan? A. Raise the bed rails so the person won't fall out of the bed. B. Place an absorbent pad on the bed for protection. C. Place the individual in the genupectoral position. D. Use a fracture pan. Think of the answer before the reveal. The answer is B. Flashcard 100. Which actions help control the spread of infection? A. Covering your mouth when you cough or sneeze. B. Disinfecting doorknobs. C. Hand washing. D. All of the above. Think of the answer before the reveal. The answer is D. Flashcard 101. When making a resident's bed, what is the final action a CNA should take? A. Hand washing. B. Reposition the bed to a low position. C. Put the call signal within easy reach of the resident. D. Smooth all wrinkles from the bed. Think of the answer before the reveal. The answer is A. Flashcard 102. In what order should the CNA put on personal protective equipment PPE? A. Gloves, gown, mask. B. Gown, mask, gloves. C. Mask, gown, gloves. D. Gloves, mask, gown. Think of the answer before the reveal. The answer is B. Flashcard 103. A CNA needs to obtain a resident's oral temperature. The resident is drinking a cold cup of water. What should the CNA do? A. Take the oral temperature immediately. B. Wait until the next time the resident's oral temperature is ordered. C. Wait approximately an hour before taking the resident's oral temperature. D. Wait approximately 15 minutes before taking the resident's oral temperature. Think of the answer before the reveal. The answer is D. Flashcard 104. A drainage bag must be positioned lower than the bladder. A. To prevent urine from flowing back into the bladder. B. To prevent physical discomfort for the resident. C. To prevent urine from spilling out of the drainage bag. D. To ensure the urine bag does not get disconnected from the tubes of the catheter. Think of the answer before the reveal. The answer is A. Flashcard 105. Your patient had a stroke, or CVA, 3 years ago. He still has weakness on the right side of his body. You are about to transfer the resident from the bed to a wheelchair. The wheelchair should be positioned at the A. foot of the bed on the patient's right side. B. foot of the bed on the patient's left side. C. head of the bed on the patient's left side. D. head of the bed on the patient's right side. Think of the answer before the reveal. The answer is C. Flashcard 106. A resident is choking. What procedure should a nursing assistant use to help him? A. Oxygen therapy. B. Defibrillation. C. Heimlich maneuver. D. CPR. Think of the answer before the reveal. The answer is C. Flashcard 107. A resident has just suffered a stroke or a CVA and has limited mobility. How often should you turn her to prevent skin breakdown? A. Every 4 hours. B. Every hour. C. Every 1/2 hour. D. Every 2 hours. Think of the answer before the reveal. The answer is D. Flashcard 108. Which of the following steps should the nursing assistant take to care for a resident with a condom catheter? A. Ensure that the condom is lubricated after it is placed on the penis. B. Use standard tape to secure the condom catheter into place. C. Connect the catheter to the drainage bag. D. Attach the drainage bag to the side table. Think of the answer before the reveal. The answer is C. Flashcard 109. Which of the following is a vehicle of transmission? A. A person's nose. B. A bedpan. C. A break in a person's skin. D. An animal. Think of the answer before the reveal. The answer is B. Flashcard 110. In addition to calling 911, what is one of the first things a nursing assistant should do when a resident is showing signs that she may be experiencing a stroke? A. Remove her clothing to provide for comfort. B. Locate the AED and use it to provide emergency care. C. Perform rescue breathing on the patient. D. Take note of when the symptoms began, monitor the patient's breathing, and look for any other changes in her condition. Think of the answer before the reveal. The answer is D. Flashcard 111. When transferring a resident using a gait belt, where should you stand in relation to the resident? A. Facing him. B. Behind him. C. To his strong side. D. To his weak side. Think of the answer before the reveal. The answer is A. Flashcard 112. How should a CNA encourage residents' independence? A. Ask residents about their preferences. B. Allow residents to do as much for themselves as possible and assist them when necessary. C. Be patient and allow residents time to answer questions and respond to healthcare providers. D. All of the above. Think of the answer before the reveal. The answer is D. Flashcard 113. Patients who lose of mobility due to a stroke or an injury often experience A. Mania. B. Depression. C. Claustrophobia. D. Dementia. Think of the answer before the reveal. The answer is B. Flashcard 114. You are assigned to provide care to a new South Asian resident who is Hindu. You are not familiar with Hinduism. How can you go about facilitating good communication with this resident? A. Take time to speak about Hinduism and her culture. B. Communicate with the resident in a loud and slow voice so that she can understand you. C. Teach the resident about your customs and culture so that she will understand where you're coming from. D. Avoid discussing Hinduism at all so that you can avoid potentially embarrassing situations or conversations. Think of the answer before the reveal. The answer is A. Flashcard 115. Which method is most effective for communicating with a patient who has aphasia? A. Giving the patient a pen and a notepad to write with. B. Using a picture or letter board. C. Giving additional time for the patient to respond. D. Making decisions on behalf of the patient. Think of the answer before the reveal. The answer is B. Flashcard 116. How should a CNA speak with a resident about his bowel movements' frequency, consistency, etc.? A. Ask the patient directly about his bowel movements when there are many people in the room. B. Do not ask the patient about his bowel movements, as the RN should do this. C. Use an indirect manner, such as asking if he has anything to report, to avoid embarrassing the patient, and hope he understands what you mean. D. Ask the patient in private about his bowel movements in a calm, clear, and professional tone. Think of the answer before the reveal. The answer is D. Flashcard 117. A widowed client asks if you could assist her in scheduling some alone time with another client in the facility. You should A. Inform the nurse of her request. B. Offer to help arrange some private time for this resident when her roommate is not present. C. Ask her who she would like to spend this alone time with so that you can help her schedule this time. D. Offer to have her speak to the facility's pastor to help her guide her future plans regarding intimacy in the facility. Think of the answer before the reveal. The answer is B. Flashcard 118. A resident with diabetes needs to lower her blood glucose levels, and this goal is part of her care plan. You see her eating cupcakes in her room. What should you do? A. Contact the ombudsman because you're worried that this may constitute a type of self-abuse. B. Do nothing. You have been present with her during sessions with the nutritionist and assume she understands the consequences of her actions. C. Tell her that you are afraid her health will get worse if she does not follow the diet ordered for her, and report the addition to her ordered diet to the nurse. D. Take the cupcakes away from her and tell her that she is not allowed to eat them. Think of the answer before the reveal. The answer is C. Flashcard 119. CNAs work in a variety of healthcare settings. If a CNA works in a long-term care facility where residents need minimal assistance with activities for daily living hours, what type of healthcare setting is this? A. Assisted living residence. B. Hospice care facility. C. Nursing home. D. Skilled nursing facility. Think of the answer before the reveal. The answer is A. Flashcard 120. Which of the following tasks may the CNA legally perform? A. Move an intravenous tube for a client receiving nutrients via and Roman 4B. Diagnose signs and symptoms of a resident showing potential hyperglycemia. C. Administer oxygen therapy. D. Position bed rails as instructed by the nurse and the care plan. Think of the answer before the reveal. The answer is D. Flashcard 121. You are about to bathe Mr. Potter, but he begins screaming and refuses to take his evening bath. What should you do? A. Tell him that he is disturbing others and threaten to restrain him. B. Call for another CNA to help you get Mr. Potter to bathe. C. Stop trying to get Mr. Potter to bathe and wait until he calms down. D. Be firm and insist that he bathe. Think of the answer before the reveal. The answer is C. Flashcard 122. When a patient consistently ignores the urge to defecate, which of the following can develop? A. Diarrhea. B. Constipation. C. Incontinence. D. Hemorrhoids. Think of the answer before the reveal. The answer is B. Flashcard 123. One of a CNA's responsibilities is to record and total residents' intake and output. How often should this be done? A. 5 times a day. B. Once during each shift. C. Every 12 hours. D. Every 24 hours. Think of the answer before the reveal. The answer is B. Flashcard 124. A resident has left side weakness as a result of a stroke 4 years ago. She is ready to be transferred from her bed to a wheelchair. The wheelchair should be positioned at A. The head of the bed on the resident's right side. B. The bottom of the bed on the resident's right side. C. The bottom of the bed on the resident's left side. D. The head of the bed on the resident's left side. Think of the answer before the reveal. The answer is A. Flashcard 125. When a patient is sundowning, what should a CNA be especially aware of? A. Screaming and aggressive behavior. B. Difficulty swallowing. C. Increased confusion and possible agitation at night. D. Increased risk of falling. Think of the answer before the reveal. The answer is C. Flashcard 126. When a doctor orders a patient to be placed in restraints, what should the CNA not do? A. Offer water and toileting every 2 hours. B. Check on the patient at least every 30 minutes to ensure that there is proper circulation where the restraints are placed. C. Tie the restraints directly to the bed frame. D. Ensure that the restraints are very tight so the patient does not escape. Think of the answer before the reveal. The answer is D. Flashcard 127. Which of these symptoms is a sign that a person is about to die? A. Irregular and shallow breathing. B. Increased respiration. C. Sudden hunger or thirst. D. Increased heart rate and blood pressure. Think of the answer before the reveal. The answer is A. Flashcard 128. Where do you tape the catheter on a male patient to make sure it stays in place when you turn him over? A. Bed frame. B. Upper thigh. C. Stomach. D. Around the knee. Think of the answer before the reveal. The answer is B. Flashcard 129. Mrs. Bornstein is a resident with Alzheimer's disease. You notice she is confused. What can you do to reduce her confusion? A. Wait until the confusion subsides. B. Encourage the resident to participate in a group activity. C. Put on a television. D. Keep the level of stimulation to a minimum. Think of the answer before the reveal. The answer is D. Flashcard 130. The nurse on duty asks you to empty a urinary drainage bag for a resident. What should you do? A. Refuse to do this task and explain to the nurse that CNAs are not permitted to perform this task. B. Empty the urinary drainage bag and let the nurse know the task is completed. C. Detach the catheter tube from the drainage bag. D. Twist the tubing in a clockwise direction before emptying the bag. Think of the answer before the reveal. The answer is B. Flashcard 131. Below are 3 stages of Alzheimer's disease accompanied by specific symptoms. Which stage is matched with its correct symptoms? A. Mild Alzheimer's disease, memory loss concerning recent events. B. Moderate Alzheimer's disease, need help with multi-step tasks such as getting dressed, bathing, grooming, or using the bathroom. C. Severe Alzheimer's disease, loss of ability to communicate coherently. D. All of the above. Think of the answer before the reveal. The answer is D. Flashcard 132. It is the end of your shift. You just measured the 8-hour urinary output of your patient, and there are 21 ounces of urine. What is your next step? A. Convert the 21 ounces to cubic centimeters CCSB. Compare this patient's urinary output with that of other patients. C. Convert from ounces to pounds. D. Call a nurse immediately. Think of the answer before the reveal. The answer is A. Flashcard 133. You are with a female patient who has urinary and fecal incontinence. How should you provide perineal care and hygiene to this patient? A. Clean from the rectum towards the labia. B. Clean from the labia towards the rectum. C. Clean only the rectum. D. Clean the labia and have the patient clean the rectum. Think of the answer before the reveal. The answer is B. Flashcard 134. A nurse has discontinued the use of a Foley catheter for a patient. What is the proper way to dispose of this equipment? A. Place the equipment in the hazardous waste container. B. Wear gloves and place the equipment in the regular trash can. C. Place the equipment in the regular trash can. D. Wear gloves and place the equipment in the hazardous waste container. Think of the answer before the reveal. The answer is D. Flashcard 135. Mr. Song cannot breathe on his own and needs a mechanical ventilator for his respiratory needs. During a storm one night, the electric power is lost in the nursing facility. What is the first thing that you should do for Mr. Song? A. Use an ambu bag to ventilate Mr. Song. B. Call the doctor. C. Plug the ventilator into the red outlet in the room. D. Plug the ventilator into the blue outlet in the room. Think of the answer before the reveal. The answer is C. Flashcard 136. What is the term for an abnormal shortening of muscle tissue? A. Arthritis. B. Fracture. C. Contracture. D. Muscle spasms. Think of the answer before the reveal. The answer is C. Flashcard 137. Patients with dementia, especially Alzheimer's disease, are prone to wandering. Which of these precautions can help protect patients from wandering into dangerous situations? A. Bed alarms. B. Picture signs by room doors, bathrooms, dining rooms, and other areas such as stop and do not enter. C. Door alarms. D. All of the above. Think of the answer before the reveal. The answer is D. Flashcard 138. You are caring for a teenager with broken arms and legs in the rehabilitation/restorative care area of your facility. He was in a serious biking accident. The most likely care goal for the patient is to A. Restore him to full and normal use of his arms and legs. B. Maintain his airway. C. Help him stop smoking. D. Assist with his end-of-life needs. Think of the answer before the reveal. The answer is A. Flashcard 139. Which of the following is an example of a common trigger? A. An unpleasant visit from a family member. B. Excessive noise. C. Pain. D. All of the above. Think of the answer before the reveal. The answer is D. Flashcard 140. Angina is A. A heart attack. B. Chest pain caused by low blood flow to the heart. C. Lack of oxygen in the blood. D. A deep breathing exercise. Think of the answer before the reveal. The answer is B. Flashcard 141. A common sign of a panic disorder is A. Joint pain. B. Intense fear. C. Chest pain. D. Loss of hearing. Think of the answer before the reveal. The answer is C. Flashcard 142. A CNA who is culturally aware. A. Does not let the resident's culture inform appropriate care. B. Ensures that the resident conforms to the CNA's culture. C. Leaves consideration for the resident's cultural beliefs to the nurse. D. Provides care that is appropriate to the resident's culture. Think of the answer before the reveal. The answer is D. Flashcard 143. The wife of a resident who has just died informs you that in their culture it is forbidden to leave the deceased's body alone before burial. At your facility, the policy is to store all bodies in the morgue. What is the best way to handle this situation? A. Call other members of the family to see if they can convince her to change her mind. B. Notify the nurse about the wife's concern. C. Tell the wife that she must stay with the deceased until the burial. D. Explain that in America, rules are rules. Think of the answer before the reveal. The answer is B. Flashcard 144. Which is the best way to communicate with a resident with memory loss? A. Sit beside the resident and listen to her. B. Ask a social worker to speak with the resident. C. Ask the resident to stop talking. She is likely repeating the same information. D. Ignore the resident and continue working. She will not remember the interaction. Think of the answer before the reveal. The answer is A. Flashcard 145. Which of the following must a CNA report immediately to a nurse? A. Significant emotional changes in a patient. B. Significant behavioral changes in a patient. C. Significant physical changes in a patient. D. All of the above. Think of the answer before the reveal. The answer is D. Flashcard 146. If a resident asks the CNA for time alone with his wife, what should the CNA do? A. Check with the nurse about the resident's health before making a decision. B. Remind the resident that the CNA has important work to finish and keep working in the resident's room. C. Remind the resident that there is to be absolutely no hanky-panky and then leave the room with the door open. D. Leave the resident's room and close the door. Think of the answer before the reveal. The answer is D. Flashcard 147. A resident has decided that he does not want any life-saving measures to be taken in the event that he stops breathing. What should be noted in his medical record to reflect this desire? A. WBCB, ADL-C, DNRD, PMC. Think of the answer before the reveal. The answer is C. Flashcard 148. Healthcare proxy is also referred to as A. Medical power of attorney only. B. A living will. C. Durable power of attorney only. D. Durable power of attorney and medical power of attorney. Think of the answer before the reveal. The answer is D. Flashcard 149. If a resident says that he is leaving the facility without the consent of a physician, who should the CNA report this to? A. Dr. B. Nurse. C. The most experienced CNA on the shift. D. The family of the resident. Think of the answer before the reveal. The answer is B. Flashcard 150. MS. Oliver has had a stroke and is having difficulty feeding herself. She will be getting assistive devices to help her eat. Which of the following healthcare workers will be getting MS? Oliver the devices? A. Occupational therapist. B. Physical therapist. C. Registered nurse. D. Social worker. Think of the answer before the reveal. The answer is A. Flashcard 151. While providing oral care, a CNA notices a fruity odor in an elderly patient's mouth. What should the CNA do? A. Report the fruity odor to the nurse. B. Skip the oral care because the patient will need a sputum specimen. C. Tell the patient to use mouthwash. D. Do nothing. Think of the answer before the reveal. The answer is A. Flashcard 152. A resident who had a stroke a few years ago needs help getting dressed. The resident chooses to wear a long-sleeved shirt with buttons. How should you help the resident? A. Put the shirt on the resident. Do not allow him to help. B. Choose a different shirt that is easier for him to put on. C. Ask another CNA to help you. It is difficult to help the patient by yourself as he has weakness on one side. D. Help him put on the shirt he chose, providing as much help as he needs. Think of the answer before the reveal. The answer is D. Flashcard 153. Which of the following foods would be best for a patient with diarrhea? A. Fried chicken, tomatoes, and TB. Bananas, applesauce, and gelatin C. Applesauce, coffee, and lettuce D. Bananas, bran flakes, and orange juice. Think of the answer before the reveal. The answer is B. Flashcard 154. Which of the following best defines constipation? A. A condition in which the stool becomes hard and dry and requires straining for elimination. B. A condition in which there is a daily bowel movement of a small amount. C. A condition in which the stool is moist and soft and requires a laxative for elimination. D. A condition in which the individual is unable to have a bowel movement for a day. Think of the answer before the reveal. The answer is A. Flashcard 155. How much sleep do older adults typically require? A. 8 to 9 hours. B. 12 to 14 hours. C. 5 to 7 hours. D. 10 to 12 hours. Think of the answer before the reveal. The answer is C. Flashcard 156. What is the first thing a CNA must do before transferring a resident from a bed to a wheelchair? A. Ensure that the environment is safe. B. Ask the patient to place his feet on the floor. C. Make sure that the wheels on both the bed and wheelchair are locked. D. Have the patient sit up in bed to get ready to move. Think of the answer before the reveal. The answer is C. Flashcard 157. Which is an example of neglect? A. Not giving a patient solid food when she is on a liquid diet. B. Letting a patient sit in soiled briefs for an entire shift. C. Using restraints under doctor's orders. D. All of the above. Think of the answer before the reveal. The answer is B. Flashcard 158. Which of the following is the most important step a CNA can take to prevent a resident from falling out of bed? A. Keeping the bed low to the floor. B. Regular monitoring. C. Padded briefs. D. Mats on the floor. Think of the answer before the reveal. The answer is B. Flashcard 159. MS. Miller has fragile skin and has experienced skin tears in the past. The CNA is getting ready to transfer her from her bed to a chair. What should the CNA do? A. Find another person to help with the transfer. B. Put plenty of lotion on Miss Miller's arms. C. Put plenty of petroleum jelly on the CNA's hands before starting the transfer. D. Grip Miss Miller firmly during the transfer so the CNA's hands do not move and cause friction. Think of the answer before the reveal. The answer is A. Flashcard 160. What physical symptom is common for CNA to provide comfort measures for when patients near the end of their lives? A. Depression. B. Fear. C. Fever. D. Chills. Think of the answer before the reveal. The answer is D. Flashcard 161. A resident's ostomy drainage bag needs to be changed. What should you do first? A. Empty the collection bag. B. Clean around the stoma gently with soap and water. C. Apply a skin protector around the stoma. D. Reattach the clean bag to the apparatus around the stoma. Think of the answer before the reveal. The answer is A. Flashcard 162. After emptying a urinary drainage bag, which of the following substances should you use to clean its drain tip? A. Peroxide. B. Air dry. C. Alcohol. D. Soap and water. Think of the answer before the reveal. The answer is C. Flashcard 163. Which of the following is an example of neglect? A. Leaving the floor to do your daily tasks after reporting to your supervisor. B. Changing the resident as soon as you discover she is soiled. C. Calling for assistance to care for the resident. D. Applying a restraint too tightly. Think of the answer before the reveal. The answer is D. Flashcard 164. When disposing of emesis, what protective equipment should be worn? A. Goggles. B. Gloves. C. Mask. D. Gown. Think of the answer before the reveal. The answer is B. Flashcard 165. Which of the following is not considered appropriate handling of linens? A. Folding the soiled portion inward. B. Carrying the linens away from your body. C. Depositing the soiled linens on the floor. D. Changing linens promptly when soiled. Think of the answer before the reveal. The answer is C. Flashcard 166. You are monitoring the urine of a resident. He may be suffering from urinary retention. Urinary retention refers to A. An inability to urinate. B. Incontinence. C. A normal output of urine. D. A large output of urine. Think of the answer before the reveal. The answer is A. Flashcard 167. You are emptying urinary drainage bags for patients who need their output recorded. Where are you most likely to document the amount of urinary output? A. On the front of the chart. B. In a patient's progress notes. C. In the nurse's notes. D. On the I&O form. Think of the answer before the reveal. The answer is D. Flashcard 168. To prevent the spread of infection, contaminated surfaces should be cleaned at the following times, except A. After spilling urine. B. After taking off gloves. C. When blood has dripped. D. After completing a task. Think of the answer before the reveal. The answer is B. Flashcard 169. A resident has urinary incontinence. This same resident wears glasses and needs a hearing aid. Which of the following increases her risk of falling? A. Poor hearing. B. Urinary incontinence and poor vision. C. Incontinence only. D. Poor vision only. Think of the answer before the reveal. The answer is B. Flashcard 170. Providing restorative care includes A. Making long-term goals with the resident. B. Enabling the resident's dependence on assistive devices. C. Reminding the resident of his limitations. D. Doing everything for the resident. Think of the answer before the reveal. The answer is A. Flashcard 171. You are helping a resident who had a stroke a year ago. She requires the use of a gait belt when trying to stand. Which of the following should you do when using a gait belt with the resident? A. Stand an arm's length away from the resident when helping her ambulate. B. Bend your back to pull the resident to the standing position. C. Twist your body when attaching and removing the belt. D. Keep the person as close to you as possible. Think of the answer before the reveal. The answer is D. Flashcard 172. A patient rings the call bell for the fourth time in the first 40 minutes of a CNA's shift. What should the CNA do? A. Ignore the call bell so the CNA can focus on more important tasks. B. Remove the call bell from a patient's reach. C. Kindly reassure the patient that he will be checked on frequently. D. Ask the nurse manager to speak with the patient. Think of the answer before the reveal. The answer is C. Flashcard 173. A resident's health is getting worse, and she fears that she is going to die alone. Her family does not come to visit often, but they are aware of her health situation. What can the CNA do for the resident? A. Ask someone visiting another resident to talk to this resident. B. Spend as much time as possible with the resident, listening to her if she wants to talk. C. Tell the family that they must stay with the resident around the clock. D. The CNA can't do anything. Think of the answer before the reveal. The answer is B. Flashcard 174. You are caring for a patient whose Roman 4 flow rate is too slow. What should you do next? A. Adjust the flow rate to the rate that the doctor ordered. B. Provide the nutrients or sugar for the resident that she did not receive from her Roman 4. C. Report its stat to the nurse. D. Help the resident adjust the catheter. Think of the answer before the reveal. The answer is C. Flashcard 175. Threatening to withhold treatment and / or making fun of a resident are examples of which type of abuse? A. Assault. B. Neglect. C. Physical abuse. D. Emotional abuse. Think of the answer before the reveal. The answer is D. Flashcard 176. A resident who is near the end of her life asks a CNA to pray with her. The CNA is not comfortable praying with the resident. What should the CNA do? A. Tell the resident that she will have to pray alone. B. Speak with the nurse to find a religious volunteer or counselor to help the resident express her spirituality. C. Ask the resident's roommate to pray with her instead. D. Pray with the resident anyway. Think of the answer before the reveal. The answer is B. Flashcard 177. When a CNA cares for a patient with diarrhea, which of the following should the CNA record? A. Types and amount of fluid the patient is taking in. B. Number of stools. C. Odor of the stool. D. All of the above. Think of the answer before the reveal. The answer is D. Flashcard 178. A patient's care plan states, help the patient to the bedside commode. PRN. When should the patient receive assistance to the commode? A. As needed. B. In the middle of the night. C. During the day. D. At bedtime. Think of the answer before the reveal. The answer is A. Flashcard 179. Which of the following is the right terminology when referring to residents with developmental disabilities? A. Mental retardation. B. Mentally retarded. C. Slow. D. Intellectually disabled. Think of the answer before the reveal. The answer is D. Flashcard 180. A standard of care tells a CNA A. The details of a procedure, including all of the steps. B. The minimum care you need to provide. C. The job description of a CNA. D. State laws that affect the CNA. Think of the answer before the reveal. The answer is B. Flashcard 181. A nursing assistant answers a call at the nursing station from a friend of Mr. Long, a resident at the facility. The friend asks how Mr. Long is doing. The CNA tells the caller that Mr. Long's condition is declining without determining if Mr. Long wants his medical information shared with the friend. The CNA has A. Violated HIPAA laws. B. Done her job correctly. C. Acted outside the scope of her job. D. Helped Mr. Long. Think of the answer before the reveal. The answer is A. Flashcard 182. Although the patient refused the procedure, the nursing assistant insisted and inserted the urinary catheter. The nursing assistant is guilty of which of the following? A. False imprisonment B. Invasion of privacy C. Battery D. Assault. Think of the answer before the reveal. The answer is C. Flashcard 183. The RN has assigned you the task of emptying urinary drainage bags for a group of patients. You should take which of the following actions? A. Complete this task and report its completion to the nurse. B. Tell the RN that CNAs are not permitted to do this. C. Kink the tubing before emptying the drainage bags. D. Disconnect the catheter tubing from the drainage bags. Think of the answer before the reveal. The answer is A. Flashcard 184. You are caring for MS. Hernandez, a resident who has trouble talking as a result of a stroke she experienced several months ago. Which of the following health team members would be assigned to provide treatment for this difficulty? A. Respiratory therapist B. Occupational therapist C. Physical therapist D. Speech therapist. Think of the answer before the reveal. The answer is D. Flashcard 185. You and your coworker are working together to remove a bag contaminated with bodily fluids from a resident's room. Which is the correct process for removing the contaminated bag? A. You remove the bag and mark it contaminated while your coworker brings in a large trash can to dump the bag into. B. You remove the bag, close it, and carry it to the door, while your coworker prepares a clean bag by folding down a cuff at the top of the clean bag and labeling the bag contaminated. C. You remove the bag while your coworker holds the door open for you. D. Your coworker removes the bag and carries it outside while you begin to clean the contaminated area. Think of the answer before the reveal. The answer is B. Flashcard 186. Which of the following is not part of standard precautions? A. Using PPE B. Removing organic material before disinfection or sterilization procedures C. Placing the resident in a single room D. Hand hygiene. Think of the answer before the reveal. The answer is C. Flashcard 187. Which of the following is not part of oral care for an unconscious person? A. Use a toothbrush to clean the resident's teeth B. Protect the resident from aspiration C. Assume the resident can hear you D. Avoid inserting fingers inside the resident's mouth. Think of the answer before the reveal. The answer is A. Flashcard 188. Which of the following is the correct temperature for a resident's bath? A. 130 degrees Fahrenheit B. 110 degrees Fahrenheit C. 120 degrees Fahrenheit D. 100 degrees Fahrenheit. Think of the answer before the reveal. The answer is B. Flashcard 189. Which of the following is not part of the recording responsibilities of a CNA? A. Always erase mistakes completely B. Always record the date and time of every observation C. Always identify the resident D. Always use ink. Think of the answer before the reveal. The answer is A. Flashcard 190. Restorative nursing care helps the patient with all of the following except A. Improves the mobility of the resident. B. Improves the communication practices of the resident. C. Improves the cognitive functioning of the resident. D. Focuses on what the resident is unable to do because of an injury or illness. Think of the answer before the reveal. The answer is D. Flashcard 191. Which of the following is not one of the 5 stages of grief? A. Bargaining. B. Donating. C. Denial. D. Acceptance. Think of the answer before the reveal. The answer is B. Flashcard 192. Which of the following is true about the use of gloves? A. The outsides of gloves are contaminated. B. Nursing assistants must use gloves every time they may come into contact with body fluids. C. Nursing assistants must change gloves every time they move from a contaminated body site to a clean body site. D. All of the above. Think of the answer before the reveal. The answer is D. Flashcard 193. Which of the following is an acute disorder or illness? A. Type 1 diabetes. B. Multiple sclerosis. C. Alzheimer's disease. D. Pneumonia. Think of the answer before the reveal. The answer is D. Flashcard 194. Which of the following is true about a patient's medical record? A. It is not important for healthcare providers to protect patient confidentiality regarding the patient's medical record. B. A patient has the right to see her medical record. C. The medical record is only important for the patient in the first 3 months of residential nursing care. D. All of the above. Think of the answer before the reveal. The answer is B. Flashcard 195. Which of the following demonstrates neglect of a resident? A. The nursing assistant provides no treatment to the resident and does not speak to or acknowledge her in any way. B. The nursing assistant threatens to hit the resident. C. The nursing assistant locks the wheels of the resident's wheelchair so that the resident won't get into trouble. D. The nursing assistant slaps the resident for talking back. Think of the answer before the reveal. The answer is A. Flashcard 196. When giving a resident a bed bath, which of the following should the nursing assistant perform first? A. Wash around the resident's eyes. B. Put on gloves. C. Lower the head of the bed. D. Provide for privacy. Think of the answer before the reveal. The answer is D. Flashcard 197. Which of the following is a strategy for preventing decubitus ulcers? A. Inspect the resident's skin during routine care and report concerns at once. B. Position the resident according to the care plan. C. Keep linens dry and wrinkle-free. D. All of the above. Think of the answer before the reveal. The answer is D. Flashcard 198. Which of the following is true about a patient with diabetes? A. All patients must take insulin. B. A patient with hypoglycemia has high blood sugar, which is a potentially dangerous medical condition. C. A small cut on the foot of the patient is a potentially dangerous situation. D. All of the above. Think of the answer before the reveal. The answer is C. Flashcard 199. Asepsis means A. The absence of all microorganisms. B. The body's overwhelming and life-threatening response to infection. C. The absence of disease-causing germs. D. A communication disorder resulting from damage to the brain. Think of the answer before the reveal. The answer is C. Flashcard 200. Which of the following tasks can a nursing assistant legally perform? A. Inserting a urinary catheter. B. Wound care. C. Giving a patient medication. D. Taking a patient's blood pressure. Think of the answer before the reveal. The answer is D. Flashcard 201. A nursing assistant may legally A. Mentor other CNAs. B. Teach other CNAs. C. Supervise other CNAs. D. None of the above. Think of the answer before the reveal. The answer is D. Flashcard 202. You are caring for a 90-year-old frail resident named Mr. Jenkins. Mr. Jenkins suffers from dementia, and he sometimes gets confused at night. He occasionally thinks that his mother is calling him in for dinner when it gets dark. What physical problem places Mr. Jenkins at risk for falls? A. His confusion at night. B. His dementia. C. His frailness. D. All of the above. Think of the answer before the reveal. The answer is C. Flashcard 203. Which of the following is a best practice when helping a patient perform ROM exercises? A. Getting clear information from the nurse and the care plan as to the kinds of ROM exercises ordered and the frequency of the exercises. B. Pushing joints past the point of pain to help increase the range of motion. C. Only performing active ROM exercises to ensure the full range of motion. D. All of the above. Think of the answer before the reveal. The answer is A. Flashcard 204. A nurse requests that you take a resident's pulse at the apical site. What should you do? A. Place a stethoscope over the resident's heart, count the number of beats in a minute, and record the result. B. Place 2 fingers under the resident's chin on the left side, count the number of beats in a minute, and record the result. C. Hold the resident's wrist, count the number of beats in a minute, and record the result. D. None of the above. Think of the answer before the reveal. The answer is A. Flashcard 205. When shaving a male resident's neck, in which direction should you move the razor? A. Any direction is fine. B. Downward strokes. C. Upward strokes. D. Side to side. Think of the answer before the reveal. The answer is C. Flashcard 206. The chain of infection includes the following: A. Germ, agent, reservoir, exit portal, mode of transmission, entry port, and susceptible host. B. PPE, hand washing, gloving, and use of hand sanitizer. C. MRSA, C. diff. D. All of the above. Think of the answer before the reveal. The answer is A. Flashcard 207. Which of the following is not a residence right? A. To make advance directives. B. To behave however one would like to behave. C. To make choices about one's life in a care center. D. To choose one's doctor. Think of the answer before the reveal. The answer is B. Flashcard 208. Which of the following is not a cause of dehydration? A. Diarrhea. B. Vomiting. C. Constipation. D. Not drinking enough fluids. Think of the answer before the reveal. The answer is C. Flashcard 209. When providing perineal care for a male resident with an uncircumcised penis, the nursing assistant should A. Scrub the perineal area thoroughly and vigorously to make sure it is clean. B. Replace the foreskin after it has been pushed back to clean the head of the penis. C. Clean the anal/rectal area first and then use the same washcloth to clean the penis. D. Clean the penis starting at its base and then moving towards the tip. Think of the answer before the reveal. The answer is B. Flashcard 210. If the patient ignores the urge to have a bowel movement, which of the following could happen? A. Hemorrhoids. B. Incontinence. C. Diarrhea. D. Fecal impaction. Think of the answer before the reveal. The answer is D. Flashcard 211. You are caring for Mrs. Tenley, a resident who has a urinary drainage bag. You empty Mrs. Tenley's bag and notice that your gloves look clean, as if you just pulled them out of the box. There is not even a spot on them. You now need to go help Mr. Fowler with a bed bath. What should you do? A. Discard the gloves, practice hand hygiene, and put on new gloves before providing care for Mr. Fowler. B. Use the same gloves for Mr. Fowler's care. No need to change them, they still seem clean. C. Use the same gloves all day as long as they look clean. D. Discard the gloves and bathe Mr. Fowler without wearing gloves. Think of the answer before the reveal. The answer is A. Flashcard 212. Which of the following is not a sign of depression? A. Persistent sadness and feelings of worthlessness. B. Progressive short-term memory loss. C. Eating too much or too little. D. Sleeping too much or too little. Think of the answer before the reveal. The answer is B. Flashcard 213. Which of the following is a risk factor for falls? A. Care equipment such as Roman 4 poles and tubes. B. Poor judgment. C. Urinary or fecal incontinence. D. All of the above. Think of the answer before the reveal. The answer is D. Flashcard 214. A nurse just changed a bandage on a patient's wound and has asked you to dispose of the used bandage. How should you go about doing this? A. Wear gloves and place the used bandage in a special hazardous waste container. B. Throw the used bandage in the trash. C. Wear gloves and place the used bandage in the trash. D. None of the above. Think of the answer before the reveal. The answer is A. Flashcard 215. You are taking care of a patient who is on airborne precautions. The patient is in a special room and you must wear a HEPA mask when you enter the room. You need to transport the resident from his room to the lab for testing. How should you transport him to prevent the spread of infection? A. Give everyone along the route a HEPA mask. B. Take the patient outside to ensure that no one in the facility is exposed to the patient. C. Place a HEPA mask on the patient. D. Transport the patient quickly to reduce the probability that an infection will spread. Think of the answer before the reveal. The answer is C. Flashcard 216. When talking to a resident about her grandchildren, you notice that she grimaces and rubs her shoulder as she speaks to you. This could be a sign of A. Sadness B. Fear C. Anxiety D. Pain. Think of the answer before the reveal. The answer is D. Flashcard 217. Which of the following should the CNA do when performing a massage? A. Leave extra lotion on a resident's skin to be absorbed later after the procedure. B. Have the resident lie on his side or in prone position and provide for privacy. C. Apply cool lotion directly from the bottle onto the resident's skin. D. All of the above. Think of the answer before the reveal. The answer is B. Flashcard 218. A new resident who is Muslim enters the facility and wants to know if there is a place where he can pray quietly 5 times per day. As a nursing assistant, what should you do? A. Respond. Let's talk to the nurse, social worker, and chaplain to see what we can arrange. B. Respond. 5 times a day is a lot to ask. Can't you just pray once per day? C. Respond. Have you thought about the role that Jesus can play in your life? D. Respond. I don't know, and walk away to give the resident privacy. Think of the answer before the reveal. The answer is A. Flashcard 219. You are caring for an 85-year-old man who has stiffness and pain in his joints, and he does not like to move because of this pain. What kind of treatment might be most appropriate for his condition? A. Bed rest B. ROM exercises C. Extra sleep D. All of the above. Think of the answer before the reveal. The answer is B. Flashcard 220. The fire alarm begins to ring in the facility in which you work. You cannot see nor smell the fire, and none of your patients are in immediate danger. What should you do? A. Begin to evacuate patients B. Run to find the fire and extinguish it C. Close the fire doors. D. Call 911. Think of the answer before the reveal. The answer is C. Flashcard 221. Which type of care focuses on comfort and support for a dying person and that person's family? A. Holistic care. B. Hospice care. C. Restorative care. D. Rehabilitative care. Think of the answer before the reveal. The answer is B. Flashcard 222. Which of the following is true about high-performing healthcare teams? A. They have zero tolerance for mistakes. B. Each team member does his job without interfering with others' responsibilities. C. The doctor is the strong central leader directing the team. D. They collaborate and communicate effectively to serve the needs of patients. Think of the answer before the reveal. The answer is D. Flashcard 223. In Maslow's hierarchy of needs, which of the following needs is at the bottom of the pyramid? A. Self-actualization. B. Love and belonging. C. Self-esteem. D. Physical needs. Think of the answer before the reveal. The answer is A. Flashcard 224. The most common reason for inappropriate behavior in residential nursing care is A. An interpersonal disagreement. B. A cognitive problem. C. A physical problem. D. A drug problem. Think of the answer before the reveal. The answer is B. Flashcard 225. 40. Which of the following is an open-ended question? A. What time would you like to get up tomorrow morning? B. On a scale of 1-10, with 1 being no pain and 10 being the most pain you can imagine, how much does it hurt? C. Do you like cookies? D. What was your childhood like? Think of the answer before the reveal. The answer is D. Flashcard 226. The nursing assistant leaves a patient's room for a 20-minute break, does not tell her colleagues, and leaves the bed rails down on the resident's bed. The care plan states that the bed rails should be raised for this resident. 5 minutes later, the patient falls out of bed and breaks his hip. Who is responsible for this? A. The nursing home is responsible. B. The nursing assistant is personally responsible. C. The nurse is responsible. D. The patient is responsible. Think of the answer before the reveal. The answer is B. Flashcard 227. A resident had half of an 8-ounce glass of water and 3 ounces of Jell-O. What should the CNA record in the I&O sheet? A. 4 fluid ounces. B. 7 fluid ounces. C. 210 cc. 90 cc. Think of the answer before the reveal. The answer is C. Flashcard 228. Which of the following is a systemic sign of infection? A. Redness. B. Lack of appetite. C. Heat. D. Swelling. Think of the answer before the reveal. The answer is B. Flashcard 229. Which of the following healthcare team members helps residents learn or retain skills needed to perform daily activities? A. Occupational therapist. B. Physical therapist. C. Social worker. D. Podiatrist. Think of the answer before the reveal. The answer is A. Flashcard 230. If one of your colleagues comes to work under the influence of drugs and/or alcohol, what should you do? A. Cover the person's shift. B. Ignore it. This is not your responsibility. C. Give the person strong coffee to snap out of it. D. Alert your supervisor immediately. Think of the answer before the reveal. The answer is D. Flashcard 231. Which of the following healthcare providers assists patients who have had a stroke to communicate more effectively? A. Audiologist. B. Clinical laboratory technologist. C. Speech-language pathologist. D. Clinical nurse specialist. Think of the answer before the reveal. The answer is C. Flashcard 232. The Resident's Bill of Rights is posted near the front entrance to the facility. What does this document contain? A. The ethical principles of healthcare. B. Key financial information about billing for Medicare and Medicaid. C. The moral imperatives of healthcare providers. D. An outline of the legal rights of residents. Think of the answer before the reveal. The answer is D. Flashcard 233. Which is the proper order of operations to perform when using a fire extinguisher to put out a fire? A. Pull the pin, aim the extinguisher at the base of the fire, squeeze the trigger, and sweep the extinguisher from side to side to completely cover the fire. B. Sweep the extinguisher from side to side to completely cover the fire, pull the pin, aim the extinguisher at the base of the fire, and squeeze the trigger. C. Squeeze the trigger, pull the pin, aim the extinguisher at the base of the fire, and sweep the extinguisher from side to side to completely cover the fire. D. Aim the extinguisher at the base of the fire, pull the pin, squeeze the trigger, and sweep the extinguisher from side to side to completely cover the fire. Think of the answer before the reveal. The answer is A. Flashcard 234. Which of the following practices opens up a line of communication with the resident? A. Interrupting the resident with a story about your social media page when the person is telling you something personal about her life. B. Sitting at the resident's eye level when the resident is seated to show that you are listening. C. Responding with answers like, I am sure everything will be fine, or just be happy, that is all you can do. D. Checking the time of the clock on the wall when the person is speaking. Think of the answer before the reveal. The answer is B. Flashcard 235. Contractures are A. A normal part of the aging process. B. The result of too much physical activity. C. An unfortunate and untreatable condition. D. The result of too little physical activity. Think of the answer before the reveal. The answer is D. Flashcard 236. When taking a resident's blood pressure, the first sound you hear is at 136. The last sound you hear is at 82. How should you document this reading? A. 82/136B. High C. Low D. 136/82. Think of the answer before the reveal. The answer is D. Flashcard 237. When caring for a patient's dentures, which of the following statements is false? A. When cleaning dentures, place a towel in the bottom of the sink. B. Dentures are expensive and difficult to replace. C. Dentures must be cleaned at least once per day. D. Always carry dentures in your hand when you go to the bathroom to clean them. Think of the answer before the reveal. The answer is D. Flashcard 238. What is the purpose of reporting? A. To ensure that your legal responsibilities are fulfilled. B. To ensure that the nurse is aware of the patient's condition and needs in order to best inform care for the patient. C. To ensure that you pass off information to someone who is responsible for the patient. D. To ensure that you follow the facility's protocols and procedures. Think of the answer before the reveal. The answer is B. Flashcard 239. Which of the following does not contribute to skin breakdown? A. Ambulation. B. Dehydration. C. Sitting for long periods of time. D. Wrinkled sheets. Think of the answer before the reveal. The answer is A. Flashcard 240. A nursing assistant finds a patient unconscious and on the floor. Of the following patient needs, which is the greatest priority? A. Breathing. B. Lock. C. Circulation. D. Airway. Think of the answer before the reveal. The answer is D. Flashcard 241. Many healthcare facilities are moving toward the goal of a restraint-free setting. Which of the following is the best way to achieve this goal? A. Use equipment such as non-skid socks during the day and bed rails at night to help prevent falls. B. Ban the use of restraints in the healthcare setting. C. Limit restraints to situations where falls cannot be otherwise prevented. D. All of the above. Think of the answer before the reveal. The answer is C. Flashcard 242. What is the universal sign for choking? A. Hands at the neck. B. Pleading for help. C. Gagging. D. Coughing. Think of the answer before the reveal. The answer is A. Flashcard 243. Which of the following is not a best practice for promoting sleep with patients who have dementia or Alzheimer's disease? A. Encourage naps during the day to promote relaxation. B. Develop a regular bedtime and follow bedtime rituals. C. Use nightlights so that the patient can see. D. Follow the patient's exercise plan. Think of the answer before the reveal. The answer is A. Flashcard 244. Which of the following is true about the Ombudsman? A. The Ombudsman is at the facility to catch healthcare providers engaging in negligent or abusive behaviors. B. The Ombudsman protects the health, safety, rights, and welfare of residents. C. The Ombudsman is an employee of the facility. D. All of the above. Think of the answer before the reveal. The answer is B. Flashcard 245. What is elopement? A. Wandering in the nursing home. B. Forgetting where you were. C. Falling in love. D. Leaving the nursing center without staff knowledge. Think of the answer before the reveal. The answer is D. Flashcard 246. A nursing assistant is going to help Mr. Fowles with a bath. She knocks on the door and waits a moment. Suddenly, Mr. Fowles looks up at her, curses at her, and throws a shoe at her. What should the nursing assistant do? A. Scream at Mr. Fowles and tell him no one speaks to me like that. B. Shut the door and ignore Mr. Fowles, as he does not deserve care if he is being disrespectful. C. Immediately tell the nurse. D. Pick up the shoe and throw it back at Mr. Fowles. Think of the answer before the reveal. The answer is C. Flashcard 247. The best way for nursing assistants to manage the effects of poor or inappropriate behavior in a healthcare setting is to A. Restrain the patients. B. Prevent the behavior. C. Medicate the patients. D. Control the patients. Think of the answer before the reveal. The answer is B. Flashcard 248. You are working with Mr. Neil and have recently begun weighing him each day. Yesterday, Mr. Neil weighed 175 pounds. Today, he weighs 194 pounds. You redo the weight measurement, and it still reads 194 pounds. What is the most likely cause of this weight gain? A. Mr. Neil has been eating lots of junk food over the past 24 hours. B. The measurements were inaccurate on both days. C. Mr. Neil has gained excess fluid in the past 24 hours. D. Mr. Neil was thirsty and drank a lot of water before the weigh-in. Think of the answer before the reveal. The answer is C. Flashcard 249. You have a patient who has a history of falls. Which of the following safety measures will help keep him from falling out of his bed? A. A low bed. B. Padded briefs. C. A gym mat on the floor. D. Monitoring the patient. Think of the answer before the reveal. The answer is D. Flashcard 250. Which of the following is a mistake of commission? A. A nursing assistant transfers the wrong resident to radiology for an X-ray. B. A nursing assistant does not report a resident's rectal bleeding. C. A nursing assistant forgets to take a resident's vital signs. D. All of the above. Think of the answer before the reveal. The answer is A. Flashcard 251. Before assisting with a partial bath, which of the following is not essential? A. Following delegation guidelines. B. Moving as quickly as possible. C. Hand hygiene. D. Explaining the procedure. Think of the answer before the reveal. The answer is B. Flashcard 252. Which of the following helps prevent plantar flexion? A. A hip abduction wedge. B. A trochanter roll. C. A bedboard. D. A footboard. Think of the answer before the reveal. The answer is D. Flashcard 253. Which of the following is not an example of objective information? A. Vomiting. B. A patient reporting a pain rating of 8 out of 10. C. A patient sweating profusely. D. Blood pressure. Think of the answer before the reveal. The answer is B. Flashcard 254. You are working with a patient named Ms. Lewis who is in hospice care. You notice that Ms. Lewis begins to give away her valuables to friends and family when they come and visit. What should you do? A. Nothing. This is normal behavior at the end of life. B. Report this behavior as financial abuse. C. Tell the nurse. D. Tell Ms. Lewis to stop giving away her valuables. Think of the answer before the reveal. The answer is A. Flashcard 255. 70. Which statement is true about patient identification? A. Some patients have died because they were not properly identified before care measures were given. B. Patients who are blind, deaf, or confused have a higher probability of being misidentified. C. The nursing assistant must identify each patient before performing care. D. All of the above. Think of the answer before the reveal. The answer is D.